Medicines are a part of healthcare. So we buy medicines whenever we are sick, or many a times for preventive purposes we buy medicines like supplementations, vitamins or many other drugs. Many a times we keep these drugs thinking that it might be handy for future use, or simply we do not know what we should do them or what we should do with them or how we should dispose them. Have you ever wondered what you can do with this half-used medication or the medications which are near expiry date? Are you guilty of tossing it to the dustbin just like that or flushing it through the toilet? We will see what you can do to safely dispose the unused medication or medication which are near the expiry date. I am Dr. Navyashree from the Department of Pharmacology. We'll see how we can safely dispose the unused or expiry medication. This is important for better environmental practices. So what are the reasons these medicines become unused? So many a times we are given prescription in bulk, we purchase these medication in bulk and store them. So many a times we recover early. Early recovery is one of the cause when the medicines become unused. The other reason where we might have unused medicines with us is non-adherence. Non-adherence means we do not stick to the prescription what the physician has prescribed for us. We may not completely use the medication what we are supposed to use, and this is how we would be holding some of the medications which are unused with us. Next is therapy or prescription change. Many a times you might find yourself with a medicine which is not suitable for your disease, or you might end up with an adverse drug reaction. So with this, the physician might decide to change your prescription, or the diagnosis might change, because of which you would be having a new medicine for your disease. The last reason might be death. So you might purchase medicines for a person for chronic illness. You would have purchased in bulk and you would have stored it. Unexpectedly, the person might die and you would be facing a situation where you have to dispose all these unused medicines. So why is this safe disposal necessary? Whenever we do not dispose our medications properly, it might go into the hands of the wrong people, especially children and pets who are not aware what these drugs might do to them, might come into contact with these drugs and it might harm them. If we do not dispose these medicines properly, it might go into the wrong hands of people with drug addictions or any other kind of addictions who might get hands on these medications, especially narcotic drugs or other abuse drugs which are not supposed to be used by them. So recent studies show the presence of therapeutic drugs in water. So how do these drugs come into the water? Even though we have a very good system which clears the water from the sewage, but still many of the drugs what we know cannot be effectively cleaned out of the sewage system. So studies have found presence of the therapeutic drugs in the environmental system, especially in the drinking water. So they have found residues of birth control pill, antidepressants, opioids and many drugs which are actually not supposed to be in the water in the first place. Even the drugs what we consume gets eliminated from the body. The residual part of the drugs from the elimination system might go into the sewage, which again might come into contact with the drinking water. These are all the reasons why we should avoid flushing down medications in the toilet so that it does not contaminate the sewage system and further the water drinking system. A recent study in Pakistan showed that there has been a drastic decline of vultures from our ecosystem. So when they studied why this decline was happening, it was because of some of the drugs called as analgesics or non-steroidal anti-inflammatory drugs like diclofenac and aceclofenac. So how these drugs came back into the contact of these vultures. So these drugs like diclofenac and aceclofenac, which are analgesics or commonly called as painkillers, were being used for treatment in veterinary practices. These vultures, which were consuming the carcasses of these animals treated with analgesics like diclofenac or aceclofenac, had kidney failure and ultimately would die. This is the reason for one of the major habitation laws even in India apart from places like Pakistan. Some of the studies even showed that male frogs, due to the consumption of estrogen which is found in the suburban ways, were getting feminized. So these are all the reasons why we should avoid leaching of medicines into the water ecosystem. This slide actually shows a study where the number of pharmaceuticals which was detected in surface water, groundwater, tap water and drinking water was studied. If you can see that India comes in the orange line where almost 31 to 100 types of pharmaceuticals were detected in the surface water. Another reason why we have to be aware of all these safe disposal is the drugs which go into the drinking water can also kill the bacteria which is present in the drinking water. So what happens over time, this can lead to antimicrobial resistance and it will lead to bacteria becoming resistant to the existing antibiotics, which is a threat, which is a global threat. What can we do for the safe disposal of unused medicines or expired drugs? So every time you get a medication, go through the label of the medication. Labels are generally present on the package of of the medicine what you use, or if not, if you have something called as drug inserts which are present inside the packaging of a drug. Read the label of the medicine or the product for any kind of disposal methods if present. So these kind of instructions will be present on what and how you should dispose these medications. So if the information is available for disposal of the medication, check if any kind of information is available regarding the disposal of medicine. If yes, read the instructions properly and follow the disposal of the medicine as instruction on the label. If you do not find any kind of instructions, check in your neighborhood or your nearest pharmacy or any hospital premises if they have any drug take back program. So what is this drug take back program? So if you have medicine strips which have not been used or tampered, you can ask in your local pharmacy or local hospital centers if they have any kind of program where they take back these medications for recycling. So if there is any program like that, you can dispose the medication with the drug give back program. If not, put the drug in trash mixed with an undesirable substance. So you can take out the medication from its packaging. Imagine you have a strip of medication, 4 or 5 tablets. You can remove the tablet and put it in a pouch and you can mix it with cat litter, or you can also mix it with coffee ground or any kitchen waste, and then you put it, seal it in a safe pouch or container and ziplock it as much as possible. Once you can put these in the normal household waste. With all these methods, you can dispose of the drug safely. There are some don'ts. What are you not supposed to do? So many drugs should not be flushed down the toilet. It is safe enough to say that the FDA actually gives a list of drugs which can be safely flushed down the toilet, and there is also a list of drugs which should not be flushed down the toilet. The flushing down from the toilets can lead these water to enter the sewage system, and in turn it might leach into our drinking water ecosystem. So avoid flushing down your drugs from the toilet. Sharing is not caring when regarding to the medications. Never give a medication prescribed for you, for your relative or friends. Especially do not share it with children. Always ask for a new prescription even if you find the symptoms are very much similar. What we talked about right now is the disposal of medications like tablets, capsules or syrups. Many a times you come across people with asthma. When you must have seen people with asthma using devices like inhalers, rotahalers or other medications which dispose the drugs directly to their lungs. When you come across inhalers which might be empty or half used, which might have reached the expiry date, always see the label of the inhaler or the rotahaler what you are using. You will see that they would have given instructions on how to dispose them. Always remember not to puncture the inhaler. You might be knowing that there is a metal canister which is present inside your inhaler. This part is pressurized, so never puncture or burn the inhaler even when it is empty. You are not supposed to even put it into the fire because of the pressure it might burst. Always keep the inhalers or any drugs out of reach of children. If you are ever in doubt what to do with the inhalers or any medication, you can always consult your physician regarding the same. Next, we'll see how we can dispose the syringes or insulin pens. India is now called as the diabetic capital of the world. So, we see many people who use insulin pens at home or syringes for treating diabetes. So, again, go through the label how you can safely dispose this insulin pens or syringes. Always separate the sharps from syringe. If you are using a syringe, always separate the sharp and put it separately in an enclosed container which will not affect any of the workers who will go through the sewage. If you are using insulin pens, go through the label, see what are the instructions on how you are supposed to dispose these insulin pens, or always secure it inside a cardboard container or a ziplock and then dispose it safely along with the other household articles. Many people would be using patches, may it be drugs like nitroglycerin for angina or any other kind of patches for motion sickness or any other medical patches. So how do you dispose these patches safely? Always close the patch on the medication side, and just like you dispose any other dry waste, you can put it in a sealed pouch or container and you can dispose it off along with the other household waste. One thing you should be careful whenever you are disposing patches, especially drugs like opioids or other narcotic drugs, see to it that it is very safely sealed and it should not fall into the wrong hands, especially people who can abuse these kind of patches. The best thing to do is always look into the label of your drug regarding the disposal of these medicines. So these are some of the references which I have used for this talk. I'd like to acknowledge the Department of Pharmacology, Yenepoya Medical College, for giving me this opportunity regarding safe disposal of medications, and yenmedia for this recording. So to conclude, we have arrived at a moment of decision. Our home, Earth, is in grave danger. What is at risk of being destroyed is not the planet itself, of course, but the conditions that have made it hospitable for human beings. These words were said by Al Gore, one of the US presidents. So it's our duty as responsible citizens to dispose of medication safely and see to it that the environment is protected and also that these drugs do not fall into the hands of wrong people. Thank you.